Testing, testing. Okay. I actually think it's a short in my daggone mic. So I'm gonna have to go out and probably get another, I guess this is a USB cord, or maybe I have one here because I think there's a short in this mic. So sorry about that, y'all. But anyway, I'm gonna try not to mess with this mic again 'cause I did something over here and the sound just went out. At least this time I can see it because usually I do not be paying attention to these cords, to the mic, to anything. I just be talking. But as I was saying, um, I did not even know this. Okay, and I thought that I saw him on a video and he was saying that he was okay. So I guess he was just lying. Okay, but anyway, retired NFL running back O.J. Simpson has passed on following his prostate cancer, his family confirmed Thursday. He was 76. The news has also been confirmed by TMZ and Fox News. And it says on April the 10th, which was yesterday, our father, I can't even pronounce his name, we're just going to say O.J. Simpson, succumbed to his battle with cancer. The family said in a treated post from his personal account. He was surrounded by his children and grandchildren. Now, they also said during this time of transition, his family asked that you please respect their wishes for privacy and grace. So, anyway, they had some reports, like I was just telling you, of his cancer, right? And it started circulating throughout social media, the news, and everything in February, with some even claiming Simpson was in hospice. And like I told you before, when they were saying that, he was basically shutting that down. He was saying that he wasn't in hospice. So I'm guessing that he went home underneath hospice care, I guess. He also posted a video. He said, I am not in any hospice. I don't know who put that out there, but whoever put that out there, I guess it's like Donald Trump says, can't trust the media, even though the media was telling the truth, I guess. I mean, he may not have been in the hospice per se, but he might have been in that situation at his own home. You see what I'm saying? So listen to this audio. I don't even want to touch this. Let me just play this. I don't want to touch anything. Hospice? You talking about hospice? No, I'm not in any hospital. I don't know who put that out there. Who put that out there? I guess I don't think he trust the media. And I'm also well, when you get to the thing, take care. Have a good Super Bowl weekend. So I don't know if he was exaggerating or if he was just, not letting people know because, he was trying to still beat it. I don't know what is going on here. You know what I'm saying? The thing about it, though, is that clearly the media had it somewhat right. You know what I'm saying? Because look what happened. Anyway, let me just give you some brief information about Simpson in case some people don't know. I mean, I don't know why you would know, but some people may not know. Anyway, Simpson was drafted first. He was drafted first overall by the Buffalo Bills in the 1969 NFL draft. A member of the Pro Football Hall of Fame, Simpson was the first player in NFL history to reach 2,000 rushing yards in a single season. I guess a single season, I guess. That's what they mean. Doing so in just 14 games. Those achievements in his ev- eventual acting career would eventually be overshadowed with his criminal history, as we all know. In 1994, Nicole Brown Simpson, his ex-wife, and her friend Ronald Goldman at her home in LA, assuring I don't know how they edit this. Okay, it's not even edited right. Okay, so let me just fill in the blanks. So in 1994, Nicole Brown Simpson, his ex-wife, and her friend Ronald Goldman at her home, I guess was unalived at her home in Los Angeles. Anyway, his trial, as well as them chasing following the SUV, was showed on the news. About a million plus people watched this. All right. Anyway, following OJ's shocking acquittal in the criminal trial, Brown's family filed a wrongful death civil suit. OJ was ordered to pay $33 million in damages. Now, in 2007, OJ was arrested for armed robbery in Las Vegas, led by OJ. A group of men entered a hotel room and took sports memorabilia at gunpoint. Simpson claimed the items originally belonged to him. Following a trial in 2008, Simpson was sentenced to 33 years in prison. He was released on parole in October 2017. So he did how many years? 2008, about 9 years, right? Yeah, because he got out in 2017. Okay. So let's see what else they got about his things. So he passed on yesterday, okay? And I guess they just notified the media today because I didn't hear anything about this yesterday. We just heard about it this morning and stuff like that. So I'm guessing they didn't say anything when he first passed away. They just waited or whatever the case is. But that's a shame. I mean, I know some people probably happy, but you know, I still say it's a sad situation. Now, somebody in the comment section was talking about that white Bronco chase. He said, I don't know if OJ unalived his wife, but it's between him and his maker now. Condolences to the family. I don't know either. It would be unfair for me to just sit up here and say that he's 100% guilty of it or innocent. I don't know for sure. You know what I'm saying? I remember when it happened. Um, I don't even want to speculate, especially now that he passed on. But that was a tripped out situation. That entire ordeal was a hot mess. Somebody said he unalived two people. He gets zero sympathy from me. Blackbird said he was a murderer. How much uglier can you get? And then Teresa said, you are not the judge. God is. Let's see. So Timothy said the Juice was one hell of a running back and seemed cool. He was found not guilty by a jury. His life is between him and God now. Rest in peace, Juice. So Timothy then said mostly I guess you mean most don't believe Simpson was guilty. I think that was a police setup, basically, and Trump is guilty, so Cochran might not have the same success. All right. And of course, people making jokes and stuff, and just saying inappropriate things. And Billy said something inappropriate. I'm not going to read that. A lot of people are, but the thing about it, if he did do it, he asked for forgiveness in a minute. You know, who's to say? Who are you to say what you don't forgive? Because as long as God forgives him, that's all that really matters. You know what I'm saying? If he asked forgiveness and all that and meant it, then God forgave him point blank. So who are we to sit up here and say what he deserves? If you are into the scriptures, it says nobody is sinless. Okay, and so therefore everybody's guilty of stuff. All right, so it is what it is. The thing about it is that he did pass on. He still was blessed to see 76. I think he was 76 years old, but he passed on yesterday, and he was battling prostate cancer. And listen, guys, it is very important for you guys to go get your prostate examination. All right, because prostate cancer can actually just be there and you don't even know it. You know what I'm saying? And then by the time you go to a doctor to get your little checkup, then it's already, advanced, So it's very crucial to go get your prostate examination. Let me just tell you what age you need to get it. We still talking about OJ Simpson. And we're not going to be on here that long either. Too, but I'll probably be on here for about 30 minutes. That'll be it. Let's see. Let's go to this. So let's just tell you guys real quick. Let me see. When should you get a prostate examination? So they said
prostate cancer screening ages 55 to 69. Treatment makes the most sense, meaning when treatment benefits outweigh any potential risk of treatment side effects.
now, let me add to this that men who are at high risk, you should get your screening starting at age 45. Also, check with your doctors too, because they may do these prostate examinations before 55. I thought it was 50 years old. Okay, so just check with your doctor to make sure. Thank you, D Shep. Y'all go check out D Shep and show him some love and support. And thank you so much. Good morning to you. Good morning to everybody. I always forget to say that because I don't usually, I had to be up. All right, but Yeah, just basically, talk to your doctor about that, males, and find out what is the best age to get a prostate examination because it's very crucial. A lot of guys pass on from prostate cancer because they go too late. They don't want to get checked, they be embarrassed, they think it's going to hurt. They think the doctor's going to do something to their area right there, which prevents them from having, relationships and stuff. But listen, it's more important to go get everything checked out because if you develop cancer, you're still not going to be able to do certain things. You know what I'm saying? So, what sense does that make? Oh, okay. So, okay. I usually say good awake, grand rising or something like that. A grand awakening. That's what I usually say. Um, Now, one of my close friends, actually, my oldest dad has prostate cancer, and he's fighting that right now. So that's what I'm telling you guys. You have to go get these checkups and make sure, you know what I'm saying? Get all these screenings that you need, especially that because cancer can really sneak up on you and you just don't know that you have it. Let me give y'all some signs of prostate cancer. What are some signs of prostate cancer? So they have 12 signs of prostate cancer. Okay, hold on. Let me get this gum out of my mouth. I told y'all I need to stop chewing this damn gum all day long and all night. It's like all day long, all night. I just have to have a piece of gum in my mouth. Let's see. Okay, let's take that out. Smack my gum and stuff. That's not ASMR. Okay, so anyway, y'all know that your prostate is a small walnut-shaped gland found under your bladder. The prostate wraps around the urethra and controls the release of urine. The prostate also produces semen, the fluid that transports sperm. Men over the age of 50 years are at high risk of developing prostate cancer, especially if it's in the family, okay? Cancer cells that grow in the prostate will usually stay in this area and don't spread further in the body. However, prostate cancer is the second most common form of the disease affecting men in the United States, and it is the leading cause of unaliving in men aged 75 years or older. Now, they said prostate cancer cells really usually go slow. So there is time to receive treatment before the disease reaches its advanced stages. So with that being said, that's why I'm telling you to make sure you go get checked out, okay? Because once you turn 50 years old, you should be asking your doctor about that, okay? But if that runs in your family or any other risk of cancer, any other cancer risk, you need to probably talk to your doctor about that to see if you need to get a prostate examination when you're 45. Okay, because it's good to catch that disease quick. Because a lot of people they don't have symptoms and they don't go get checked up because they don't want nobody touching them there. They be scared they can't do anything. They just be scared of stuff, so they don't go. Next thing you know, by the time you go, you got full blown cancer and they can't really do anything about it. Okay, so you need to go in there as soon as possible when you're supposed to and get these prostate examination done. It don't really hurt anyway. It may not be all that comfortable, but you know what? The pain from having cancer supersedes the pain from getting your prostate checked. Okay, let me tell you something. Next week, I'm going to get a biopsy of my. Let me make sure I get this right. My uterus. Okay, they're gonna take some type of like a little magnifying, like a little scraper, and they're gonna scrape the lining of my uterus to make sure that I don't have any type of cancers. All right. I don't want to get it done, and I know it's gonna hurt a little bit. All right. However, I know the benefits of catching stuff early versus catching stuff late. And so women go through a lot of procedures that hurt. So you men got to start braving up and go ahead and get these tests done. Okay. You got to. Yes, it's a little bit uncomfortable, but once it's over, they check, they tell you everything is okay. You are going to feel a whole lot better. So many people pass on from prostate cancer, and they don't really need to. And even though it spreads slowly, most people, if they don't go get a check, they end up postponing it to the next year. Then it ends up in the next year, then the next year, then the next year. Next thing you know, it's 10 years later. You know what I'm saying? So that's why you need to go ahead and get a check. Has it did what? Wrong any. What do you mean by that? And hey, Nicole, thank you so much for coming in. Y'all check out Nicole and show her some love and support. Magnificent. The finest Tyler is here too. Good morning to you. And y'all go show her some support as well. Okay. The reason why I'm getting a biopsy is because I was having problems in that area. Okay, so therefore they're going to check that area out to make sure. I doubt that I have any cancers. I really do, but you got to make sure. So they're going to check that area just to make sure. And they told me I didn't really have to get it done, but if I wanted to, just go ahead and get it done. And so I decided to go ahead and get it done. I believe in getting stuff done anyway. Like think if I wouldn't have never told my cardiologist about the stuff that I was feeling with my heart, I wasn't really even feeling anything. It's just that when I was going up the stairs, I was wondering why I was getting out of breath when I got up to the third level. And I told my cardiologist, he was like, this is because you're getting older. I was like, no, because I'm in shape. I'll be working out and I never get out of breath. And then when I was like doing my TikTok videos, I'd be dancing, I started sweating all quick. And I usually can dance for about almost 2 hours before I start sweating. You know what I'm saying? And I started sweating like in the first 15 minutes, and I knew something was wrong. So when I first went to the cardiologist and told him, he was, kept on saying because I'm getting older and things like that, and I need to basically understand that. You know what I'm saying? And I was like, no, 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 no. So I went on and listened to him for a minute, but I kept telling myself, no, this is not normal. So I went back to the doctor and had him give me an echocardiogram and some other tests. You know what? All the other tests came out good. But when he did the echocardiogram, that's when it showed that my functionality had decreased. Now think, if I would have been scared, like a lot of people are, or just listen to my cardiologist tell me that because I'm getting older, knowing that I never felt like that before, and I really didn't have any other symptoms, okay? Didn't look like I was having anything going on or anything. Just, what would have happened? I would have kept on walking around until one day I would have had a heart attack. And I'm not even old like that. And I would have probably passed on. So that's why you have to go and get checkups when you feel things. Even when you don't feel things, you need to go to the doctor and get things checked out, at the age that you need to. Okay, there's nothing wrong with going to get a prostate examination. There's nothing wrong with going to get a pap smear, a mammogram, skin cancer check, just anything. Even men get mammograms too. Even men now get mammograms. There's nothing wrong with doing all of these things. You need to do this so you can make sure that you are healthy. You know, and the thing about it, you got people who have money and things, and they don't even go to the doctor to get checked out. You said, yeah, some women uterus grow and pushes up against certain. Okay, yeah, I don't have that. Thank goodness I don't. And a lot of times the uterus gets stretched out, I guess, pushed down into the bladder. All right, after you have a bunch of kids. So mine is prolapsed a little bit, but not like that because I pretty much try to do all these type of different exercises and stuff. You know, y'all men don't know all these things we women go through to have children, and that's why y'all need to show us respect. There's a lot of stuff kids do to your body when you're pregnant. All right. So, but something else was happening with my uterus, and that's why I'm going to go get a biopsy sometime next week. And stuff. So, if I'm brave enough to go to get a biopsy, y'all should be brave enough to go get a prostate examination. If you are 45 years old, you need to check with your doctor if you have any type of cancer stuff running in your family. If you are 50 years old, you need to be asking your doctor when is the time for you to go get a prostate examination because some doctors do them at 50 years old. All right, it's just better to catch it quick than catching it late. Now let's see what else they said. So here are the symptoms. There are 8 of them. Okay, and now granted, some people don't feel these symptoms. This is why I'm telling you guys to get your prostate checked out. And y'all got to excuse me if I'm making bloopers. I'm kind of tired from being on YouTube all damn night, and plus I did my own live. All right, so let's see what y'all said over here. I'm getting a uterine. I know I'm going to say this wrong. Ablation to help with my heavy cycles, and they will also do a biopsy during that procedure. And see if you're brave enough to do this, and this is a lot, everybody else should go get their stuff checked out. And you're right. It's better to be safe than sorry. Oh, you are? Okay. Okay. So these shit smart. Goodness. Okay. All right. So the first symptom is difficult or painful urination. All right. Now, they said it is common for men to develop a condition known as dysuria. I think I said that right, in middle age. Now, various adverse health conditions cause dysuria, including bladder infections, bladder cancer, and prostate cancer. Now, dysuria, if I'm saying that correctly, is best described as a burning sensation while you are urinating. Sometimes affected individuals make, as this, people don't do no editing. Let's see. Sometimes affected individuals may experience trouble urinating as well, even if their bladder feels full. Now, this urea can cause mild to severe pain in the pelvic area. The condition indicates that a mass is pressing down on the urinary tract. In most cases, this additional pressure comes from an enlarged prostate gland. The prostate can enlarge due to a condition known as benign prostate hyperplasia or plasia, which is also called BHP. Okay. Now, it is important to note that chronic bacterial prostatitis is a common cause of urinary tract infections, leading to painful urination. If you experience frequent bouts of dysuria, it could be from exposure to this bacteria, or it could be a warning sign of prostate cancer. So go to your doctor to get checked out, point blank. Anytime you feel like you have a UTI or a bladder infection, which is totally two different things, go to the doctor because a UTI can go to your kidneys, okay? It can spread to your kidneys. And you really don't want anything to be messing up those kidneys. It's one of your vital organs, okay? Point blank. Them kidneys go, I mean, you have to go get dialysis, all types of weird shit. You know what I'm saying? So if you have a UTI, if you think you have a UTI because you urinate a lot and it's painful and all that type of things, and it's hard to pee, you need to go to your doctor as soon as possible to get a urinalysis, or they can take blood as well. Let's see, do they take blood? No, they can do a culture. They can do one inside the clinic, then they can send it out to the lab so they can check more. They can check more. You know what I'm saying? Put it underneath the microscope and all that stuff and check and see and everything. And then they can tell you what type of bacteria it is and give you the correct medication to treat it. That's what they can do. Okay. But you don't want to be walking around with a UTI or even a bladder infection, because that UTI definitely can spread to your kidneys and it can cause more, you know, more things. You know what I'm saying? And I also think that it can spread further into your body, if I'm not mistaken. I got to look it up to make sure, but I really do think that is true. All right. So you said, Bishop, you said I had a scope. Wait, what? I had a scope, my urethra. I had to have a scope to check my urethra to check for blockage and or blockage due to an irregularity with my stream. Okay. Oh, okay, okay. Wow. I bet you that hurt, didn't it? Okay, damn. But y'all know what I had done? I had an angiogram at a young age, obviously, because I've been going to a cardiologist since I was young, you know what I'm saying, because of my hypertension. And so they did an angiogram. Of course, I was the youngest person there, where they stick a long type needle through your let me get this right, through the artery, I think. Or is this a vein? It's one of the two. Which let's see. I think they stick it through your artery, if I'm not mistaken. And they guide that needle all the way up to look at your heart and all that to make sure your arteries, I think that's right. Yeah, the arteries are not clogged up. And they can tell you how clogged your arteries are. And so mine wasn't clogged up at that time. I did that procedure back in 2019, right before CV19. Or either it was 218, I can't remember, one of the two. 19, 20. Yeah, it was 219 because it was 5 years ago. And they checked it. And once you get, I forgot what the blockage, 70%, I think, then you are, at a chance for what? Heart disease or something like that. I have to look this stuff up to make sure I'm telling you guys the right information, but I'll look it up in a minute. But yeah, that's what I had done. And y'all know I went in there like a G. I looked up everything, researched everything, looked at the procedure online, And then I actually sat there, well, not sat there, but I laid there. Yeah, I was looking good in the hospital bed. I made sure everything was looking good. I had on my little, not this hat that I always wear, I had on another hat. And, I wanted to look cute while they was doing the procedure, okay, I'm not gonna lie. I took pictures at the hospital bed and stuff like that, and I was talking to the doctor the entire time while they was doing the procedure, and he was so proud of me the way I went in there and did that, and, and wasn't scared or anything else, but it's also a good idea to find out about procedures before you get it done, okay? So you won't be scared, and then convince yourself to go ahead and get those procedures done. Just like I'm not going to look at this procedure that they're going to do with the biopsy because I don't want to see that because I pretty much know what they're going to do. What I'm going to do though is put on some Vagisil. Let me stop, y'all. I'm giving out too much information. Y'all, I'm not lying. I'm going to numb myself with some Vagisil with Benicaine in it. I'm not joking. Okay, and I'm gonna take a ibuprofen before, and then I'm gonna go get that done. And the reason why I'm doing that is because I'm allergic to everything. Right? I cannot use regular stuff, no gel, no nothing. They have to use a special speculum and everything. So I need to use my stuff to, block out the pain and everything else. Okay, and I still have allergy reaction too from from another ultrasound that I had. So this is gonna be a hot ass mess. But I'm gonna go ahead and get it done, and I'm gonna numb up that area so I won't feel shit. And I mean, I'm not gonna feel anything. All right. So let's see. Very painful, even after they numb the area. I'm pretty sure it is. Goodness. Can you imagine? Goodness, you scaring me now. Hmm. But the urethra, yeah, oh yeah, yeah, going up that little hole and stuff like, oh yeah, yeah, yeah. That's when they got to take that thing up. Oh yeah, we don't need to talk about that anymore. Yeah. Mm-mm. So they're gonna put you to sleep. Yeah, I'm not getting put to sleep because of my heart thing. I wouldn't even want to be put to sleep. I'm gonna take it like a G, ha ha ha. But you having more stuff done, Brown Sweet. So they're gonna put you asleep. But when I had my tubes tied, I got my meds to numb my body, but I had the option to be asleep. Okay, okay. I have only been put to sleep one time because back in 2016, I was pregnant and me and my husband lost the baby. I think it was because of some peanut butter that I ate. And I think that's the year they was recalling peanut butter. And I think that I had that peanut butter and it messed, it underlined my child. And why is this on here? And that was a tripped out experience, guys. I mean, it really was. I don't even like talking about it, but it really was. And I actually, you know what, y'all? Because I don't like people feeling sorry for me. I'm so weird when it comes to stuff. Y'all, I went to the doctor by myself. All right. I did that procedure by myself. My nurse was like, "Where's your husband at?" I said, "I told him to go to work." Okay. I really did. I heard the nurse in there sounding all sad and stuff. I'm trying to be brave and stuff. I hate when people not hate, but I dislike when people start all that crying and stuff. You know what I'm saying? I really do. I don't like that. But I did a good job when I went in there. I had to have like a DNC, I believe. They had to take the baby because I didn't expel the baby, so they had to take the baby out and stuff. And they did a DNC to clean out, I guess, everything. And then they asked me, did I want to did I want to remain so me and my husband can bury the baby? And I told them just bury the baby with all the other little babies that were lost like that and stuff. But I got the paperwork and all that. I don't like talking about that, y'all. It's a sad situation. So let me stop talking about it. But yeah, that's the only time I was put to sleep. Okay. And that's the only time. Yeah. Let me change the subject from that. Number two, y'all. Very weak urine flow. Now, men in the initial stages of prostate cancer will notice that their urine stream begins to weaken and the pace at which urine leaves the body starts to slow down. Now, as the cancer cells grow in the prostate, they damage the muscles and nerves that control urine flow. This sign is also commonly caused by BPH, where the enlarged prostate begins to exert pressure on the urethra. And I just know that hurts, man. The next one, wait a minute, hold on. They said difficulty in starting urination is another issue that appears alongside a weak urine stream. This condition is known as urinary hesitancy. Same thing, women can get that too. And men affected by that experience embarrassments that makes them avoid public urination. Wow. And so they say as the condition progresses, it becomes more difficult to start urinating, even if the bladder is full to its maximum capacity. The urine stream becomes weaker and weaker, leading to a very uncomfortable feeling while urinating. As a result of the lack of pressure, many people suffering from the condition strain their abdominal muscles to start the flow, resulting in an uncontrollable urine stream. Goodness. Let's see the next one. Here they go with all these ads, y'all. Let's see. See if we can close. The next one is using the bathroom a lot, peeing a lot. Hey, Red Squid X Files, thank you for tuning in. And y'all show him some love and support. He really do be talking about some interesting topics. So go check him out and show him some love, okay? And check out Brown Sweet, y'all. I forgot to tell you guys to check her out because she's another great content creator. She does a lot of home decor. She takes you to work with her because she's in the military, successful career in the military, and successful woman. You know what I'm saying? And so she shows you guys a lot of things. She decorates. Her house is so beautiful. She decorates so good, y'all. So go check her out so you can get some ideas. So okay, so here we go. And salute to you, King. All right. So okay. Now, the next one, like I said, is going to the bathroom a lot, frequent urination. They said when cancerous tumors press against the bladder, it results in more frequent trips to the bathroom as the bladder has a reduced capacity to hold urine. This condition is another warning sign of prostate cancer that you should not ignore. The cause of the symptom is often confused with BPH and requires a doctor to diagnose this. Okay, so go to the doctor if you are experiencing any of these things. Don't be scared. Okay, don't be scared, y'all. Now, reduced volume in the bladder combined with dysuria can lead to a feeling that the bladder did not release all of the urine during your last trip to the bathroom, resulting in the need to visit the restroom more frequently. Incontinence is another symptom of prostate cancer that happens when the gland clamps down on the urethra during the last moments of urination. Now I know with women, when we go to the bathroom, honestly we can just cough to make ourselves urinate. All right. If we have to pee, we can't. You can actually cough. But I don't know if that's true with men because y'all stuff is a little bit different than ours. Anyway, they said as a result, the affected individual may dribble or leak small amounts of urine for a few minutes after finishing urination. Some men even wear, those little absorbent pads to prevent the urine from leaking into their pants or down their legs, like some women do too. That's why it's very important for women to definitely go to the bathroom and void as much as possible, and also to do those Kegel type exercises. And it's hard to control those muscles down there. But if you put your finger down there, up there, and you squeeze while your fingers there, you can actually feel those muscles, right? And you can practice like that. But make sure you put on a glove if possible to do that, or wash your hands. And then put your finger up there and just squeeze on your finger as hard as you can, and do that about 10 times to start, maybe 5 times if you just start doing it. And then just gradually increase it, and just keep on doing that to see if you can help. Don't do it when you have to pee though. Do it after you void, after you empty your bladder and stuff like that. Then you do those Kegel exercises like that. And then once you learn how to control your muscles there, then you don't have to stick your finger up there anymore. See, I know how to do that automatically because I didn't have to do no finger stuff, but I just know how to do it automatically. Because like if you do that, if you haven't, with a dude, with your husband or whatever the case is, you can do the same exercises on his, and you can figure out, let me stop y'all, but you can figure out, the muscles and go from there. All right. Too much information, right? But anyway, I told y'all I was kind of weird, okay? But people do tighten up like that to make the sensation feel better. You do that, you know what I'm talking about. So I think it's the same muscles that you'll use. Yeah, because I'm gonna actually sit here right now doing the exercises. Like, you should do this a couple times a day. Just do it, not when you have to pee, but like after you pee, after you completely void, and then you do that. You know what I'm saying? And it can help strengthen your those muscles down there and stuff like that. And you can tell your doctor as well, they can do some things too. But I'm trying to do stuff naturally because all these damn operations, all these things they put places, it's just not good. And plus I'm allergic to everything. So I try to do everything natural if I can. Because like my doctor was telling me, don't have surgeries unless you definitely have to have them, okay? Point blank. The next one is hematura, if I'm saying this correctly. Hematuria. This condition refers to blood in the urine, y'all. It is a scary sight to see your urine turn dark brown. Now, typically, hematuria happens when there is damage to the kidneys from a forceful impact or bacterial infection. That's why you need to go to the doctor if you think you have a UTI, because a lot of times microscopic amounts of blood can be in your urine, okay? Very small amounts that you can't even see with your naked eyes. And then sometimes you can see it with your naked eyes. So, you need to go get a checkup. And also some other things, nitrites, I think, I can't remember what it's called. They also be in your urine a lot. Okay, nice. I think it's nitrites. I can't remember, something like that. Now they say men that are experiencing blood in the urine that are otherwise in good health may have prostate cancer. All right. Now, if you already have kidney disease or something like that, you may see that, but you still should be telling your doctor if you see, blood in your urine. Okay. The next, let's see. So they say hematura is a critical symptom of the disease that you should not ignore, and it requires immediate medical attention. Blood in the urine is a sign that a tumor has damaged the urethra or prostate, resulting in bleeding. This symptom happens no, 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 no. This symptom happens during the advanced stage of the disease, where the prostate has reached a size that's large enough to disrupt normal urinary tract function. Right. See, this was my problem. I used to do this a lot when I was younger because I refused to go to the restroom because I was so germ crazy. I didn't want to sit on toilets. I didn't even want to stoop over toilets. And y'all know what? I don't sit on any toilets now. No public toilets. I squat right and teach myself how to hold squats positions for a long time. So therefore I don't sit on anybody's toilet except myself, my own, I mean. And so when I was younger, I used to refuse to go to public restrooms and all this type of stuff. So what I was doing is holding my urine for hours. And so what that did is that I believe it stretched my bladder just a little bit, right? Even I think that I have cystitis, even though my urine doctor, my urinologist said don't be claiming stuff, okay? Because she don't think I have that. She don't see it, so don't be claiming anything. But I like sometimes my bladder will hurt, so that's why I do acupuncture, which I'm going to get that done today for my bladder. To stop bladder pain. It stops a lot of stuff, y'all. So you may want to check that out if you're having like pain in your bladder or even frequent urination, or even like if you have a lot of UTIs and things like that, that bladder acupuncture may help with that, along with drinking a little cranberry juice. I can't drink cranberry juice, but some people, you can drink cranberry juice and it helps flushes out that bad bacteria. It reduces the amount of bacteria in your bladder. All right. And in that area. And then drink a lot of water, not too much water though, but drink enough water. You know what I'm saying? Make sure you go to the bathroom as soon as you have to pee, if it's possible. Save holding your urine until the time you don't have no choice. Other than that, go to the bathroom. Let me tell y'all a funny story. The other night I was up in the mountains. Y'all get ready to laugh y'all ass off. I went to the bathroom before I went to the mountains. All of a sudden, when I got to the mountains, I had to pee. And there was nowhere to pee. I'm gonna tell y'all exactly what I did. Y'all, I haven't done this since 1991 when I lived in Cleveland. Y'all, I'm not lying. I pulled over to the side of the road where it was safe at. I left my car running, obviously, because, my daughters was in the car. I went to their side, closed my door, went to their side, looked around, make sure no coyotes or nothing else was out there. I'm not lying. I had to urinate and I just urinated right outside. And I always have tissue and paper towel and wipes and sanitizer in my car. So of course I had all of that. And they laughed so hard because I was like, listen, my bladder starts hurting. You know what I'm saying? It really do start hurting. And that's from all the years of me holding my urine like I did. So I have bladder pain if I hold my urine too long. And when I say my bladder start hurting, I mean it start hurting when you almost have to go lay down. So I was like, F that. I don't give a shit. And so I waited, and the place was secluded anyway. And when I was on the other side of the car, I did hear another car coming, but I just stood back there so they couldn't even see me or see what I was doing. And y'all, I could not believe how well I could squat down without peeing on myself. It was like perfect. I couldn't believe it. I was like, man, when I did this back in 1991 or 1990, my ass was peeing all on myself and stuff. And I was way younger. And I was like, it was no pain or nothing. You know what I'm saying? It was like I was on the actual toilet peeing. You know what I'm saying? And I said I was going to tell y'all about this because this was crazy as hell. I'm out here in the middle of the mountains. I'm not joking when I said it. I was in the mountains, up in Temecula wine country, and my ass had to pee so bad. I was like, if I don't get to the bathroom, I know what's going to happen. I'm about to pee, and I'm not going to be able to make it to the bathroom. Or either what happens when you hold your urine for a long time, at least with me, that sphincter. I think that's the correct thing that I'm saying. It's something like that. Anyway, what it does is that it basically kind of locks up, meaning that I can't even pee really. You know what I'm saying? So I don't like that to happen. Plus I'm not trying to mess up my system down there and stuff. And since it's not really giving me no real problems, I don't want to be doing stuff to that area unless I really have problems. So I figured out, along with my doctors, just to go to the bathroom and to avoid holding urine too long and things like that to make that happen. And it's actually been working because I haven't had that situation going on in a while now. So shit, I was like, forget that. I'm going to pee. I don't give a shit what nobody say. I don't care about them laughing. I don't even give a damn if somebody actually see me. I was saying that because I'm not going to hold my urine, you know. And plus, I had my shirt over me, but they're not gonna see anything. You know what I'm saying? I'm skilled at squatting. I'm telling you, I do squats every day, and I'm not lying. I went right out there and peed. And then when my ass came back, I'm trying to look over there and see if I see any pee over there. That is so crazy. You know that? That's crazy. And then I say this stupid stuff. Well, there's a bit of sharing left right there. So, when I pass on, there's sharing right there in the ground. That's what I was saying. I always say crazy stuff like that. When I throw gum out, I say the same thing, it's just so crazy. But I had to pee so bad. That's exactly what I did. And if I have to pee again, I'm going to do it again because I'm not going to sit up here hold my urine. If a police see me, I'm going to tell them straight up, something is wrong with my bladder. I cannot hold my urine. Okay, point blank. So you just have to give me a ticket for indecent exposure or whatever because I'm not going to hold my urine because if I'm in the hospital, you know what I'm saying? What you say, Disha? If I'm if I'm in a hospital because of my bladder stop, my bladder is messing up or I stop peeing, you're not gonna be here with me. Okay, so it is what it is and stuff. But nobody saw me. It was a car coming, but they still couldn't see. Because I know how to do it. I still remember from back from 1991. Even though, like I said, back in 1991, it was a disaster because when you're younger, you're silly as hell. Plus it was somebody with me. It was actually my boyfriend was with me. He was making jokes and shit. It was funny as shit and stuff. But yeah, but that was a trip, y'all. Too much information, I know. But hey, if you got to pee, you better go pee. So you said my daughter had to urinate while we were in the mountain climbing in Colorado, halfway up the mountain. I know that's right. Shit, ain't nobody gonna be holding no urine. Shit, please. I know I'm not. I sure am not. Shit. My son goes outside all the time. We be out places. He'd be like, I got to pee. He'll go into the behind the building or whatever and go pee. And I'm like, boy, stop doing that. But when you got to pee, you got to pee. You know what I'm saying? Oh yeah, y'all. Don't use no more than 3 emojis. I keep on forgetting to tell you guys, no all caps, no spamming. All right. So Nightbot won't be tripping out. Let you say, you said it felt pretty cool. You did acupuncture on your bladder? Oh, you said I got acupuncture before my second pregnancy. Okay. Okay. Really? Okay. Yeah, you do. Let's see. Yeah, the acupuncture, when I used to first get it, it did not hurt. Then oh God, I be having so much weird things happen to me, y'all. Y'all just don't know. When I was doing lift, okay, I don't know. I don't know why I let people hug on me and stuff all the damn time. So this old lady hugged me. I don't know who did it, but somebody, some older person was hugging me or somebody. And she must have had shingles because she spreaded this shit to me. And I caught it, man. That's the worst shit you could ever get, okay? Shingles, okay? Hell, if you go to the emergency room with shingles, they immediately take you to the back. I mean, immediately. You know what I'm saying? They be putting all their little shit on. They be like, you got some damn, I don't know. They act like you got, I don't know, some. It is a contagious disease, but they be really they're doing a lot. And so that shit is a hot ass mess, okay? And I was younger, obviously, and I really didn't supposed to even catch it. You know what I'm saying? Too young to catch it. And I caught it anyway, just like my daughter caught it one time, and she's only in her 20s. My daughter who lives in Texas, she caught it, and I didn't believe her. I thought she was lying. And so when I caught it, she was laughing because she was like, you know, I thought only a certain age group can catch shingles, and it's not true. Anybody can catch that. And so the old lady gave it to me. I was so damn mad. And when I caught the shingles, of course I couldn't go get acupuncture or anything else because I had to stay isolated, right? So therefore, when the shingles went away after all that damn time, and I went back to get acupuncture, this shit started to hurt. And so now it don't hurt as much, but it still hurt a little bit when I go get my acupuncture. So I don't like it like I used to. You know what I'm saying? Because I don't like that little needle going into my little ankles and shit and going to hit the I guess the artery or something. I don't know if it hit the vein or the artery. I'm thinking it hits the artery, all right? And so they can get on the right arteries so it can go to the right parts of your body, like your bladder or wherever. You can get acupuncture for anything though. I should get it for my heart, but yeah, that shit is a trip though. But I get it done every 2 weeks. But huh, let's see what else y'all said. Yep, yep, yep. You can get that for your bladder. You can get acupuncture for your bladder. You can get acupuncture for almost anything. But I'm scared now to get it all over my body. I was gonna get it all over my body and stuff, but I'm kind of scared now. All those little bitty needles and shit, and they hit the nerves. Did I say vein arteries? The nerves. They hit the nerves. Okay, that's what it hits and stuff. But is it the nerves? I don't know what the hell I'm talking about, y'all. Okay, but anyway, it hits the nerves. Okay, just put it like that. I'm gonna have to look that up so I can tell you guys the right information in a minute. Okay, because I'll be saying some weird shit up here. All right, let's keep that on the real. But anyway, let me finish telling you about these symptoms. Then I'll tell you what it hits because I'll be saying some crazy shit at times. So anyway, they said blood in the urine is a sign that a tumor has damaged the urethra or prostate, resulting in bleeding. This symptom generally happens during the advanced stage of the disease, where the prostate has reached a size that's large enough to disrupt normal urinary tract function. So they said you can also confuse that with other kidney illnesses and diseases. So make sure you go to the doctor to get checked out if you think you have a kidney infection, or if you see blood in your urine, or you have pain there, or you stop peeing, or whatever, anything abnormal, go to the doctor. Let's see what else. The next one is I hate the way they do this. You have to keep on pushing all this stuff. Okay. Ugh. Number 5 is blood in the semen and painful ejaculation. All right, so that is a sign of prostate cancer, and blood in the semen is also a sign of prostate cancer. And the medical term for that is called hemo. Let me see if I can say this right. I don't know if it's hemospermia. I think it's hemospermia. I think that's what it is. Anyway, it's HEMATOSPERMIA. It's a cancerous. Tumors are prone to bleeding. Blood in the semen can also happen after a recent prostate biopsy, and the symptoms subside naturally after a few weeks. A lot of people will be scared to get that prostate examination because of that, and they may have to wear something or whatever the case is. Anyway, the condition is challenging to identify as most men don't examine their semen for blood. But y'all better start examining it just to see. They said it can also be a sign of a less significant health issue as well. Bloody semen can come from a variety of other causes, including infections or inflammation of the glands, ducts, and tubes that move semen in the body. Affected areas may include the vas deferens and epidermis, which is the regions where sperm develop before ejaculation. All right. If you notice any sign of blood in your semen, contact your doctor as soon as possible, because it could also indicate some sexually transmitted disease as well. Y'all nasty selves. No, I'm just playing. Number 6, fatigue and weight loss. Men experiencing signs and symptoms of prostate cancer may also notice that condition affects their appetite and energy levels. Now, these symptoms are typical for any form of cancer and are among some of the first warning signs of the disease, where you don't want to eat and you start losing a lot of weight. They say when cancer develops in the body begins to feed the cancer cells, causing them to multiply. Damn, you would think they could think of a cure um, to stop the body from feeding the cancer cells. Now, anyway, as the cells reach a critical mass in the affected organ or region, they start to create a sensation of fatigue that lasts from the moment you wake up until the end of the day. Dang. Fatigue is an entirely different feeling compared to just being tired. Fatigue does not go away, y'all, no matter how many naps you take or cups of coffee you drink. Unexplained weight loss typically happens alongside feelings of fatigue. As cancer cells spread, the body starts to feel less hungry, and as a result, the affected individual begins to eat less, leading to weight loss. And that's why a lot of people who have cancer gets very small. All right. Right. Take a look at your BMs because that also can indicate if something is going on with your body. If you see blood there or if it just look different. If once you have a BM, you should be looking at that anyway. I don't know why people don't look at stuff. I look at everything. I know it's gross, but I just really do. Just like I check myself every time I take a shower. I check all my parts. I really do. I told a doctor and she was laughing so hard, but she was like, she's glad that I do that because a lot of women don't check their area or anything else. They don't know anything about it, or anything. I notice everything. I see everything. I check everything because I'm not playing around with all these diseases. You know what I'm saying? The next symptom is swollen legs and feet. Now, they say it may seem like it's unrelated at first, but swollen legs and ankles can also be a sign of prostate cancer as well as heart disease, okay? And also hypertension. Cancer cells affect the lymph nodes or lymph nodes by constricting their size, reducing the flow of fluid through the nodes. As the condition progresses, the cancer cells metastasize, causing severe or mild, how do you say this word? Swelling. I'm just going to say swelling in the feet, ankles, the lower limbs, and the abdomen area. Okay. So make sure you be checking this out. All right. And the medical condition for that is called lymphedema, I guess. Lymphedema. So that is one condition of prostate cancer. Now they said the medical community refers to this condition as lymphedema, I guess, or lymphedema from prostate cancer treatment usually causes swelling in one or both legs, or either in the tummy or around the genitalia area. The lymph nodes remove toxins and waste from lymph fluids. When cancer cells attack the lymph fluid, the stem add, the result is a swelling in the affected regions. And you know what? You can see this like, hey, Iceman, thank you for coming in. Good afternoon to you. It's morning here for me. But thank you so much for tuning in. Y'all go check out Iceman and show him some love and support. Y'all, he be over there tripping. He also plays music and he have those little jam sessions and his little smoke sessions. So go over there and check him out. You know what I'm saying? Show him some love and support. Um, a lot of times when you catch um, colds and viral infections, your lymph nodes swell too. And for women, sometimes if you get that little forgot what you call that little ball thing that sometimes women get in their vaginal area. Sometimes your lymph nodes right there swell up as well. Yeah, they really do. Or like in my case, when I got that allergic reaction from getting the vaginal ultrasound, my lymph nodes swole up as well as other areas because that's the allergic reaction, and stuff. So you have to make sure you're not allergic to stuff. You have to make sure that you just take good care of yourself and just know your body, point blank. So now they said sometimes medical professionals sometimes confuse this condition with cardiovascular problems because it produce some of the same effects. I just told you guys that when you have cardiovascular problems, for some people, they do swell up. In my case, I never did. So that's why you have to know your body, know when something is wrong. Sometimes you cannot be listening to these doctors where they be telling you there's nothing wrong with you. That is just a part of aging. It's not true all the time, especially if you know that you normally don't do certain things. So anyway, they said also you can go check with your doctor to check your lymphatic. I think I said that right. System. Lymphatic. That's your lymph node system. Okay. What causes polyps? I have to tell you that in a minute. I have to look that up because I don't remember off the back. I don't want to tell you guys no wrong information. I'll look that up in 1 second. So the next and last one is erectile dysfunction. Okay. Now, a lot of dudes, have problems there. Now, sometimes it's not caused by prostate. enlarged prostate or anything like that. Sometimes it's just because you're getting older, or because you may be on hypertension medications or some other medication that may be causing you to have erectile dysfunction. Okay, so if you are experiencing that, don't be embarrassed. Go talk to your doctor about that versus going out getting all these drugs and shit and you don't know what's causing it. All right. Just because a guy ages, it doesn't mean that he has to go through that. You know what I'm saying? Some guys don't. So go get that checked out if you are experiencing that. Some dudes start developing this at around 40 something years old too. They really do. So when y'all be talking about women being old, look at yourself. All right? Look at yourself. Now, our last sign of prostate cancer comes from the treatment aspect of the disease. If cancer remains undetected and undiagnosed, the cells can reach the advanced stages of the disease and require removal through surgery. All right. Doctors can remove cancerous tumors from the prostate using different methods depending on the stage of the disease. Prostatectomy, which is a procedure that removes the prostate and seminal vesicles while sparing the nerves. Radiation therapy can result in ED over the course of treatment because it's messing with your nerves, erectile dysfunction. The blood vessels and nerves surrounding the prostate are incredibly delicate. That's why it's so sensitive there. And it's possible that an inexperienced surgeon may cause damage to their normal function while removing the cancerous tumors. All right. So trauma to their area affects blood flow to the you know what, and as a result, many men receive ED symptoms post-op. Men that receive excellent surgical assistance typically find that ED symptoms subsides around 12 months after surgery. And you know what? That's why a lot of men don't like doing it because they be scared that they're not going to be able to function properly. But don't be scared about that. Go make sure you get that shit checked out because if you get cancer and it spread, you're not going to be able to do anything then either. Okay. So go ahead and get that checked out, get that prostate checked. All right. So you can be healthy. So you can be there for your girlfriend, your wife, your boyfriend, or whatever you got. Okay. Your kids, yourself, yourself. All right. Go get that checked out. All right. And I'll just tell you how they do that real quick. And then I'm going to tell him what polyps are. Polyps, I think polyps are little bitty, grape shaped little things, but I don't think those are cancerous. Okay. But let me check that to make sure because a lot of people have polyps, but that doesn't mean that you have cancer. So, wait a minute, hold on. What did I just say I was going to check out? The procedure itself. Okay. That's what I said. Y'all be forgetting shit. And I've been doing this forever. Okay. Like even when I was in my teens. Okay. So, don't be talking about because I'm getting older because that's not true. I've been doing this forever. I've been a dodo bird for a long time. Smart, but a dodo bird. I'm not joking. Be saying weird shit at times. But when you look good, that's what happens. You got to give up something. Oh my goodness. Okay, let me do this. What do they do when they do a prostate examination? Hurry up. So the patient. Okay, here we go. Listen.
Patients bend over the exam table, positioning their elbows on the table. Wearing a lubricated glove, the doctor inserts his index finger into the rectum. We then palpitate the prostate from side to side a couple of times, taking a feel for nodules, bumps, lumps, or a hard spot.
So y'all got that? So you're gonna bend over. All right. Some of y'all are used to bending over, so don't be acting like you ain't never bent over before. But anyway, that's a whole other topic. So you're gonna bend over over the exam table. You're gonna put your elbows on the table. Just bend over, put your elbows up there. Y'all stop acting like little girls. The doctor is gonna have a lubricated glove. Y'all know what that is, because y'all know. Then the doctor inserts his index finger into the rectum. Now, if you are scared to do it, you can ask the doctor, can you numb you up? Okay. With some type of numbing cream, you know? Then he's going to take his index finger, put it up there, right? Obviously. Then he's going to be going from side to side a couple of times, feeling to see if he feel bumps, nodules, which are probably like those polyps or something. I don't know, nodules, probably hard little bumps or something. And then some lumps or hard spots. That's what he's going to do. And then it's going to be over. Now let's see what nodules are. What are nodules?
According to National Cancer Institute, nodule, listen to pronunciation, Nodule, a growth or lump that may be malignant, cancer, or benign,
Okay,
not cancer.
nodule. Okay, that's the correct way you say it. Nodule. Okay, that is a growth or lump, like I was saying, something, a little lump or something that may be malignant, which is cancerous, or benign, that's non-cancerous. A lot of times it's benign, non-cancerous. Okay. Now you asked me what are polyps. What are polyps? It's an abnormal tissue growth on a mucous membrane. Okay. You can have nasal polyps. Okay. You can have colorectal polyps, and that's just like a small clump of cells that forms on the lining of the colon or rectum. It's usually non-cancerous, just like I just told you, and it's attached to an inner wall, wherever it could be, like in the womb, or if it's like up in your rectum, up in your nasal cavity, or basically, I think polyps can grow many places throughout your body. A lot of women have polyps. Some men have them, just like a lot of women have cysts, but it doesn't necessarily mean that you have cancer or anything because it's just something common women get. So I'll tell you what a cyst is. What is a cyst? It's an abnormal, usually non-cancerous growth filled with liquid or semi-solid substance, sometimes causing pain. Like sometimes women will get a cyst in their vaginal area, by their you know, that area right there, by the uvula and all that stuff. I think that's what you call that area, and the vulva and all that stuff. And sometimes it goes like on the outer part of your vaginal area, and it be kind of hard, right? And like when you first start getting like that, some people call it a boil. Like when you first start getting like a boil or a cyst, but the boil, I think a cyst, I don't know about that cyst, but I know with a boil, when you get it there, you can take like a hot well, not too hot, but a semi-hot, not where it's going to burn you, but if you put that on that boil when you first start getting it, a, a bunch of times per day for about 20 minutes, and just keep on heating it up. Not too hot though, don't burn yourself. It can make that boil go ahead and, come to rise and eventually break open. You know what I'm saying? You can also, when you put that, like if you get in a shower, a hot shower, not too hot, and make that area soft, you can also push on that boil. That helps too. It makes it come to a head, either just go away. Because I'm gonna tell you straight up, when I was pregnant with my daughter, I got a boil, right? But they called it something else because I got two of them. I got the first one. They called it something I can't remember. They call it a Bartholomew cyst. Okay, so that right there, you couldn't just take no hot compress to get it down. So what they had to do when I was 4 or 5 months pregnant, they had to take. I had to go to the doctor, right? And they had to take a surgical knife. They cut the Bartholomew cyst. They punctured it a little bit, right? And when they did that, they actually cut it. Shit, forget they didn't puncture shit. They cut it, and they pushed on it to release all of the stuff that was inside of, which was pus, obviously. And they pushed on the pus and blood. They pushed on it, right, and stuff. And then what they did is took some iodine, put it on a cloth, and they stuck it up in there. And every single damn day, my soon to be ex had to change that damn thing and put another iodine cloth inside of that bowl. That Bartholomew cyst was on my behind. Okay, that's where that was at. And so when you have a cyst like that, I think they have to go in and size it, or whatever the case is, and then they drain it and stuff like that. Then they stick a iodine cloth. At least back then, that's what they did. And the reason why they do that is so that that cyst won't come back. And it actually worked for me. It never came back. And I had to push on it. What my husband did, that he pushed on it and all that. That shit hurt like hell. That iodine going up in that little open space right there on your meat and flesh, that shit hurt like hell. I'm not gonna lie. That's one of the worst painful things I have ever done, especially while being pregnant. And then after that, I got it was. And then after that, I got a cyst in my other area. And shit, I was like, forget that shit. I'm gonna show you what I'm gonna do about this. A boil. And so what I did is I got a hot compress, because one of my African friends told me to do this. I got a hot compress. He was like, girl, stop being so damn scary and stuff. And he said, "You rather do it yourself or go into the doctor? Which one would you rather do?" So I did it myself. So I took the hot compress, put it on there, made it real, real soft, and I started pushing on that damn thing. It was hurt like hell, and I made it come to a rise, and it was so disgusting. And I had on surgical gloves and stuff, and then I put some antibacteria stuff on it, and that shit never came back. And anytime I feel like something like a boil is coming, you know what I start doing? I go to the shower, put on a hot shower, and I start pushing in that area because I'm not going to be bothered with that shit. You know what I'm saying? That shit is painful. If you let a boil get big on you or even a cyst, it is one of the most painful things you could ever experience in your life. And don't get one when you're pregnant. It will make you go into labor. I'm not joking. That is one of the most painful things. I'm telling you, it was more painful than the angiogram. It was more painful than childbirth. All right. When that pain came, I'm telling you, I didn't feel anything with no baby. I'm gonna be perfectly honest about that. So if you get boils, yeah, it does. If it stink though, that means that you may have an infection. Fortunately, mine didn't. Not the one that was in my other area. It didn't. The one on my gluteus maximus probably was because that was an infection and everything, and that was a Bartholomew cyst, and they gave me an antibiotic. But the other one was not and stuff. And so yeah, you need to smell it to make sure because if it smells, that means that it could be possibly an infection or whatever the case is. But yes, a lot of times we can get rid of stuff though if we can just catch it really, really quick. Okay. Just catch it real, real quick. Now let's see what the acupuncture, because I be telling y'all shit that I just be making up. When they do bladder acupuncture, what do they hit with the needle? Let's see. Let's see. So they insert that needle. Let's see. Hold on. Let's see, y'all, if I can find this. I'm pretty sure they hit the nerves. I don't know what the hell I was talking about some arteries and veins and weird shit. Okay, let's see. And they do use it for urinary incontinence. How do I say that? Incontinence, and then leakage and things like that. And they've been doing that in Korea for thousands of years. They sure have been for that. So let's see. Let me see. What did they say? It's the nerves though. I know I didn't know what I was talking about at first when I was saying arteries and shit. But isn't the nerves? Wait a minute, is the nerves different? Let me look at see y'all. See, I be like on a whole nother level when I'm on these lives. Let me see. Hold on. Let me ask them because they went into all this shit. During bladder acupuncture, are they hitting the nerves? Let's see. Yeah, they do. And they do consider it as an invasive method. They may potentially cause mechanical damages to the nerves. That's if you get a person who don't know what the hell they doing. I'm going to an actual doctor though, a urinologist. I mean, you're a urine. What do you call those doctors? Oh God, just the bladder doctor. Shit, I be forgetting these medical terms. Okay, that's what I go to. I don't get it done like in no damn nail place or no place like that. Yeah, it's the nerves. You're right, D Shep. Pressure points. Let's see how does it work for your bladder. So yeah, they do this by stimulating points with needles, just like D Shep said. He's so smart. And they said it's thought to regulate, what is this? QI circulation. For OAB, needling at points on the kidney or bladder meridians could reinforce QI and promote the recovery of bladder functions. I told you. That's what they do. So the nerves, so they do the lower urinary tract is innervated by three sets of peripheral nerves, pelvic parasympathetic nerves, which arise at the scarial level of the spinal cord. So in it excite the bladder and relax the urethra, lumbar sympathetic nerves, which inhibit the bladder body and excite the bladder base and urethra, and pudendal nerves. These damn words are absolutely hard. All right. So that's what that acupuncture does, y'all, for the bladder. Damn. All this time I never sat here and just read about it. But that's why it works. But the thing about it, when you first get the acupuncture, it may hurt a little bit, but and it may not, but it makes you urinate a lot afterwards. At least it does for me. But then after a day, well, a couple hours, I'm usually way better. You know what I'm saying? So I like it. It's been working for me, so that's why I keep on getting done. As a matter of fact, I got about 10 more minutes on this live. Then I got to go get ready real quick, and then I'm going to go up here and run to my appointment to get my acupuncture for my bladder. But just hearing about Simpson unaliving, passing on from prostate cancer. Oh, I did. Thank you, urologist. Thank you, D Shep. I told you I'd be in a whole nother level when I'm on these damn lives. Thank y'all for correcting me and telling me, because I'd be like, this is why I can't get on camera, because I would really be messing up. But I am gonna get on camera though one day, when I do these lives. But y'all gonna have to help me then too, because I'd be like tripping out. Stage fright. I've been having stage fright for the longest, camera fright, all that type of weird shit. I be doing weird shit when the camera comes on. Even when the camera's not on, I be doing weird shit. If I'm not on this live, I know every word. I know how to say it correctly. As soon as I get on this live and I think people are listening to me, I be doing the most. I be saying the most. I be forgetting shit and all types of weird shit. But I'm doing all right, because I used to be really horrible at this. But anyway, thank y'all so much. So the urologist that's where I'm going to. The urologist to get my acupuncture today and stuff. But damn. Okay, yeah, that shit, yeah, but it's okay after you get it done. Like I said, it helps your bladder, it helps with incontinence, it helps with bladder pain, it helps with frequent urination, it helps with a lot of stuff, along with making sure you void and make sure you drink enough water, not too much, and stay away from sodas, which are pops. I call them pops because I'm from Cleveland, but they call them sodas here in other places. Stay away from a lot of caffeine, sugary drinks. Stay away from that shit that hurts your kidneys and your bladders. Alcohol, smoking cigarettes, all that shit damages your kidneys and stuff. I know y'all don't know that. Weed probably does too, the smoke from that. So just check that out and double check. If you smoke weed, just don't be overdoing it. You know what I'm saying? Just like alcohol, don't be overdoing it. Listen, y'all, start taking care of yourself, all right? For real. Because you want to age gracefully, all right? You don't want to be sick walking around here in and out the hospital. Let me tell you something. If I wasn't taking care of myself, a lot of people with low functionality, they be out of breath, they can't function, they be super tired, their legs be swollen up. I don't have no symptoms other than, like I just said, sometimes when I go up the stairs, a lot of stairs, I be not out of breath completely, but I be out of breath. When I dance for a while, the same, I start sweating, but they put me on some medication. I think it's working. Hopefully it's working, and it was doing okay. It wasn't like great, but it was doing okay. But hopefully, it's working more now. And I try to get enough sleep. You definitely got to get enough sleep. Then I take QCO, whatever, but that helps with your heart. Then I take magnesium. Magnesium is an important vitamin, but you need to check with your doctor first. An important mineral that you can take. It helps your heart as well. All right. And then, of course, I take vitamin D3, but you need to check with your doctor, because you don't want to get too much vitamin D3, because it can cause, harm to your body, just like magnesium can and a lot of other things can, vitamins. That's why you need to talk to your doctors. Make sure you get lab work to make sure that you need certain vitamins before you take it, especially vitamin D3 in magnesium and things like that. My magnesium was kind of low, so therefore I needed it. My D3 was low as well, so I needed that. So those type of things right there helps with the heart health, along with eating a lot of green veggies, staying away from sugar as much as possible. I need to stop that shit. And just basically getting a little exercise if your doctor say you can do it, and get enough sleep, limiting your stress. That's why I can't deal with stressful ass people. You know what I'm saying? Hey, Young Riz, y'all check out Young Riz and show him some love and support too. He talks about a lot of good, interesting topics, like music topics and things like that. So check him out. He also streams his friends' lives or whatever the case is, and do a live with them. So go check him out, show him some love and support. But make sure, yeah, flax seed oil. I need to get that. Let me screenshot that, because I need to get this. I need to ask my doctor, can I take it first? But I think he told me to get that already, and I just didn't get it. Because y'all, I'm trying to live. I ain't trying to pass on. You know what I'm saying? Damn, I'm too young. Because just think this: if I would have went to the doctor and didn't notice anything, I'm telling you, if you have low functionality, when it start getting down to 20%, shit, and 10%, it's almost over. I mean, not saying that you can't get brought back up, but damn, that's when they start. Actually, when they get down to 30%, they actually, start talking about all these different procedures they can do, like putting a pacemaker in, or defibrillator, whatever you call that thing. I think that's what it's called. They can put that one of those inside of you and stuff. And you just don't really want to be going through all that stuff if you don't have to. You got to fight. You know what I'm saying? You got to fight. You got to take your medications. You got to get enough sleep. You got to exercise. You got to take vitamins. You do whatever it takes to keep that heart, working and try to get that functionality up. Because even though they claim that it's very rare that you can get it back up. But you know what? God can do anything that He wants to do. All right. And that's on everything. Whether you believe in God or not, He still is going to do whatever He chooses to do for you. All right. And so you should never give up. That's why it's very important to catch things like cardiovascular problems, prostate cancer, all that type of stuff, any type of cancer. You need to go get these examinations to make sure that you are okay. Because again, if OJ, I don't know what OJ Simpson, I don't know what he didn't do or whatever the case is, but that's what he passed on from, yesterday. And a lot of other people pass on from prostate cancer. And like they said, it's a slow, progressive, progressing cancer. So therefore, if they catch it in time, you can pretty much get rid of it or control it or whatever the case is, and you won't succumb to it. They can stop the cancer from growing. That's what I'm trying to say, from spreading and stuff like that. So go in there and get that shit done. Stop being scared. I told you what they do. You just put your arms up on your elbows up on a daggone table. You bend over, put your arms up on that table. The doctor take that little index finger with a glove on with lubrication on. Y'all know what kind of lubrication they take on. Stop acting silly. And then she stick her index finger up there and feel it around your little walls up there in your rectum to test, I mean not to test, but to feel, to see if she feels any lumps or nodules or cancerous growths or tumors or whatever the case is. They can feel all that, cyst or whatever. So let them check you out. If you are 45 years old, check with your doctor if you have a history of prostate cancer or any other cancers in your family. And just check with your doctor anyway when you get 45, for real, for real. And then at 50, I don't give a damn what they recommend. You check with your doctor anyway to see if you can get that done at 50, if you need to get it done. Because I actually think they need to move that up. I thought they said 50, so just check with your doctor and get that done. And don't be scared. Don't be scared. And yeah, you may be scared because you may be scared that afterwards you're not going to have, you can't, you have ED. They said it goes away after what? What did they say? It goes away after, I forgot the timeline, but they did say it goes away. Okay. And some people don't even experience that, you know. So just take that chance. You know what I'm saying? And you may see a little blood afterwards, but that's normal. As long as it's not too much. You may have to wear something, but nobody knows. You know what I'm saying? Nobody knows. If only y'all knew what some women go through after having babies, y'all would be able to handle y'all stuff a little bit more. Hey, Mickery Gamer, thank you so much for coming in. Y'all check out Mickery. He's a gamer, he's a teenager. He's a gamer. So go check him out and show him some love and support. Because, even though if you're not a gamer, you don't like those games, when you go watch it, you change your mind because they do like whole movies and stuff and they be interesting. They really do. So check him out, show him some love and support. All right. So yeah. So it is what it is, y'all. Y'all need to do that. And I think I covered everything. I told you guys about prostate cancer. I told you guys about the veins, artery stuff. Let me just tell y'all, arteries, one of these, just so y'all can know, because I be saying crazy shit up here. What do veins and arteries do? We got to give y'all a health class up here. So listen.
Arteries carry blood away from the heart, and veins carry blood towards the heart. With the exception of pulmonary blood vessels, arteries carry oxygenated blood and veins carry deoxygenated blood. Arteries have thick walls with muscle tissue.
Okay, so y'all got it. Arteries away. So remember, A is for away, sorry. Veins carry it to the heart. So if you can just remember that the arteries means away, then you know good and damn well what the veins do. All right. So now you know. And when I had the angiogram, let me just see where they stuck that needle at. When having an angiogram, how do they do this procedure?
According to NHS, the angiography procedure, a long, thin, flexible tube, catheter, is inserted into the artery and is carefully guided to the area being examined. You may feel some pushing and pulling when this is done, but it should not be painful.
Okay, so there you go. I told you guys about everything. Now you know, you're a little bit smarter today, and I hope that, this live will convince you to go ahead and go get that prostate examination done if you are within the age range, okay? Because we definitely need to stop people from succumbing to this type of cancer that can be treated successfully if you catch it early enough. It's a very slow progressing cancer, so therefore you need to go get checked out starting at age 45 if you have a history prostate cancer or any other cancer in your family. If not, then around 50 to 55 is a good age to get it. But check with your doctor if you are 50 to see when they recommend you should get a prostate examination. If you experience any of those symptoms, painful urination, slow urination, blood in your urine, blood in your semen, um, you start losing weight, don't feel hungry. I can't remember the rest of them, y'all, but I told you all of the signs. You can look them up on Google. If you feel any unusual signs in that area or in your body, go to the doctor and get that checked out for real, for real. Listen, everybody's life is very, 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 very expensive. Okay. Everybody's important. It doesn't matter how much money you got, your position, or anything else, your race, your age, your size, your looks, or anything. Everybody is important. Okay. Everybody costs a lot. Take care of your body like you know this. Okay? Don't let people put you down or anything else. All right? Have that confidence that you need to have, you know, be positive, take care of yourself, try to eat as best as you can, as healthy as you can. Try to limit your alcohol, your drugs that you may be taking. If you're on drugs, you don't need to be taking drugs at all. Okay? Get help with that. Just like if you're abusing alcohol or even weed, get help with that. But if you're just a casual drinker, just try to keep it at a minimum. Same thing with the smoking weed, okay? Because some of these things are very harmful to the body. I don't care what they tell you. Remember, the people would tell you stuff so you can buy the stuff. They don't tell you the truth all the time, okay? Years later, they start telling you stuff about things, and then it's too late. So just look at everything with a what, with one eye open, one eye closed. I guess I forgot how they said it, but just look at everything carefully, and make sure you just take care of yourself. Again, my condolences are expressed out to OJ Simpson's family, his friends and fans. May he rest in peace. I'm not going to cover his little trial or his little stuff with his ex-wife and tell you anything about that other than what I just told you, because I don't think people should be bringing up certain things when somebody passed on. All right, point blank. They did say he passed on due to um, prostate cancer. All right, and it is what it is. Okay, just like Mr. C, who was Big Daddy Kane's producer, he also passed on. I think it was yesterday as well. He had a stroke. I don't know what his stroke was caused from either. So let me see if they got any updated information before I get ready to leave. And then I got to get out of here, y'all. Mr. C. Oh no. Let me just say, Big Daddy Kane's producer, Mr. C. Let's see. Let's see. So they don't have anything updated about him. Let's see. Not a thing. Let's see. Let me just type his name in here. Let's see. I got his name spelled wrong. That's why I came up. So let's see. They don't have any updated information yet. So as of right now, we still know that he passed on due to a stroke. All right. And that's all they have on here regarding him. And my condolences are expressed out to his family, his friends, and fans as well. May he rest in peace. In sad, sad situation, y'all. But when we was born, we know that one day we are going to pass on. But we don't want to try to speed it up by not taking care of ourselves or getting involved with people who are lunatics or crazy or just dangerous or do dangerous activities or anything else. All right, we just need to focus on being healthy and just doing things like we should, and get that prostate examination. He was what? He was down low? Really? For real? D Shep, let me see. Y'all be coming telling me stuff I don't even be knowing about. Let me see. Was Mr. C bisexual? Wait, Smooth B or Mr. C getting caught? Wait, hold on. I'm gonna turn this down. Hold on. Hold on. Let me see this. Y'all may have to cover that out in a couple of weeks just to see. I'm not gonna cover it right now because it's kind of disrespectful. Oh, he was caught with a transgender? He claimed he never knew he was. Oh, no, no. Smooth B said never knew he was gay. So what year was that he was caught? It was 3 years ago, huh? Wow, man. I didn't even never even heard of that before. Wow. That is crazy. Mm-mm-mm. We're gonna have to cover that. Hold on, y'all. Let me do this. We're gonna have to cover that. So now I'm gonna have to go in here and take a wash up because y'all made me miss my shower time. Okay, so I'm gonna have to go ahead and take a wash up so I can throw on my clothes and get ready to go up here to this day going. I'm gonna do this challenge dance. I'm gonna be looking goofy as hell when I do it too, but I'm doing this one. Hi, I can't wait. Girl told me to stop sticking out my tongue. She don't know I always do that shit being silly. Some people don't know that when I do stuff, I just be acting silly. I'm gonna do that challenge next because that's kind of an easy dance until I try to do it, and it's gonna be hard. But yeah, I'm gonna go in here and take a real quick wash up and stuff, and throw on my clothes and go up here to this doctor. You right, damn. So it was a long time ago. It's a lot of these rappers and stuff and men that be getting caught with transsexuals. I know my friend who comes here. He's here right now. I don't know if he's here right now, but he was here. He's actually a law enforcement officer. Carl is here as one. Okay, I told you guys that before. So he was telling me about people who be in prison. He was telling me there's some, not everybody, but he was telling me about all the things that be happening in prison. That's what made me decide to do a whole topic on prison. Because a lot of these dudes get out of prison, try to act like they heterosexuals or they be doing the most. And I want to warn these females about some of these men that be coming out of prison knowing good and damn well they are bisexual or they have bisexual encounters. And you guys need to be truthful. You know what I'm saying? Just be truthful, because some women won't look at you all crazy and stuff like that. You know what I'm saying? So just be, truthful about it, because there's a lot of diseases going around here, and nobody wants AIDS or HIV. You know, but a lot of dudes get out of prison or jail, especially prison though, where they be in there for a long time, and they be lying, and they know good and damn well that they have had a bisexual encounter. But since they was top, or they got desperate, they don't feel like they bisexual, but you are, because I don't care how desperate you are or how much you want female stuff. I just honestly don't think it's something that a heterosexual would even think about if they are straight up into women. I just don't see it, because I'm heterosexual and I could be locked up and I don't like a woman. You know what I'm saying? As much as I used to like Beyonce, my husband used to, my soon to be ex, he used to joke with me, making jokes about Beyonce because I liked her a lot, right? And he was like, I bet you if Beyonce was in a room with you and try to hit on you, you would, talk to her and things like that. I told him, no, the hell I won't. No, I won't. I don't like women. I was like, how many women try to talk to me in ATL in Cleveland when I used to live there? And I used to be like, no, I'm not bisexual. No way. No, no. Even when I first came out here, women was trying to talk to me, telling me, that I look good, they like my lips, all types of weird shit. Because I like when I first moved, I used to wear like jogging suits all the time, a lot, right? Not all the time, but a lot. So when I finally put on regular clothing, I noticed one lady was like, "You got a nice shape. Why come you don't show your body and stuff?" And that's just because my kids was little, and I was, always like, busy with them and stuff. And I thought that was kind of weird. You know what I'm saying? But it is what it is. She probably was bisexual, but I don't give a damn what a woman look like. I don't like women, so I feel like a man who is heterosexual, I don't give a damn unless he's RAPED. I don't feel like he would be doing anything with no another man or doing something to a man unless he is bisexual. I just don't see it. That is not even something that I could even believe. If a dude told me this, I'm gonna straight up say that you are bisexual if you did anything with another male. Just like if a woman has done anything with another woman, she is bisexual. I don't care what she say. And I don't know why people be trying to make this a secret, especially if they've been incarcerated. You need to tell the truth. Yeah, Atlanta is a trip. One time these dudes tricked us into a bisexual club. You know what I'm saying? We thought we was going to a regular club. I've been tricked twice like that too. And it was a, bisexual men and gay men were up in there and stuff. And some of the bisexual men was trying to talk to me and my girlfriend, but I didn't talk to none of them, not on that level anyway. And we hurried up and got out of there too, because I wasn't comfortable. And then one time I went on a date with a dude. He was playing a trick on me, and he was like, "Let's go into this bar and grill, this club or whatever it was." I get in the damn bar and grill or whatever. This bitch jump her ass up on my table with her damn bikini on dancing. I'm like, I got up and walked out of there. He was laughing so hard. I'm like, girl, I don't want to see you dance on no damn table. You up here all half naked and shit, girl. I don't like girls. Okay. And so then I went to a male review with my girlfriend, and we watched men, strip and stuff like that. And they didn't strip all the way down to nude. They just had on their G, whatever you call that shit, jockey or whatever you call it, G strings or whatever. And they was doing the most. They had women up on the stage with them simulating, actual acts and stuff. Of course you can put the money down the actual underwear, but I didn't. Shit, I just I think I just handed him $1 or $2. I can't even remember. And so I didn't want them dancing up in my face, shaking their stuff and stuff, y'all, because I was kind of shy anyway. And plus, I don't get into that. It don't do nothing for me. And some of those guys be some bisexual or either gay anyway. But yeah, they was dancing. They was doing the most. They do more than the women do. They really do. They let you get up there basically on top of the dude. He be simulating extra stuff. He be doing the most. You know what I'm saying? It was a hot ass mess. I have never went to another one since that day. That was a hot ass mess. He was doing the most, y'all. I'm not gonna lie. Let me see what time. Y'all gonna make me late for my appointment. Let me get my ass off this computer, okay? Hold on. Let me check to see what my time my appointment is, because y'all asses gonna have me late, and then I'm gonna have to hurt y'all. All right, and that's on everything through the screen. Let me see. Hold on. Be up here talking all damn day. Let's see. Hold on. Let me check to see what time my appointment is. It may be on my Gmail. Let me check to see if it's on my Gmail. I'm gonna have to throw on my clothes for real now. I'm gonna have to do one of those kind of wash ups the women do when they be hooking up with these men and play when they be cheating on their men and stuff, and they be hooking up with another dude, and they go in there doing them little sponge baths and shit so they can smell fresh, and then they go home like they never did nothing before. That's what they be doing. That's what I'm gonna have to do. Yeah, I'm so damn crazy. It's ridiculous, but they do be doing that though. They really do. That's what they be doing. Let me see. Where is my Let's see. Where is it at? It's on here. So I gotta see what time my appointment, because I'm gonna have to really go ahead and throw on some clothes now. But I'm still gonna wash up. Fuck that. I ain't going nowhere without washing up. But what I ain't gonna do is here it is right here. Let me see. I hope this is at 11:30. Oh no, I got to get off here, y'all. It's at 11 o'clock. I got 20 minutes to get ready. Thank goodness my appointment is not too far from me and stuff. So yeah, thank y'all so much for tuning in. Again, you have no clothes on. Me, I don't. I just got on a t-shirt. Yeah, I actually just got on a it ain't even a t-shirt, y'all. I got on these, you know those little black shirts that you can see underneath of my shirts when I be doing videos. I got on one of those shirts in my underwear only. That's it. That's how I be in my room. I be looking sexy too, y'all. I be so dang go crazy, but I do. But yeah, that's what I got on. That dude know about that. You know what I'm saying? That's why he be tripping. But yeah, I'm so stupid. I always got to put some jokes in there. But yeah. But I'm gonna go throw on my little clothes real quick. Go in here and try to. My hair is basically. I always be putting. I got to learn how to comb my hair, y'all, for real. I'm just gonna throw on this little hat, and thank goodness I don't be wearing no makeup like that. I'm gonna put my little concealer on a little bit though, and try to do my eyebrows real quick. Actually, I didn't even go to sleep last night, so everything looks the same. So I may not even do any damn thing with my face. You know what I'm saying? Because I still got that same concealer on underneath my eyes. I may just put my hat on and throw it and wash it real quick, brush my teeth obviously again, because I brush my teeth like 3 times a day, and take my other medicine and get the hell out of here and stuff, and then come back and stuff. That's what I'll probably do. So anyway, y'all, let me go ahead and do roll call, and I got to get out of here because I don't got that long to get ready. I got to get out of here. I should have been getting ready while I was sitting here, but I didn't. Um, Thank you to Carl is here for coming by showing support. I know your ass wasn't gonna say anything else because you be working, but it's understandable. I'm just glad you got me on. Thank you so much, officer. I'm just joking. Thank you to you a sellout. No, I'm talking about you a sellout, Carl. And here I got a whole son that's a police officer, right? And here I was in college at first for law. What the hell am I talking about, right? Right. He's gonna go back and listen to this replay and just be sending me damn messages or either calling me up. Okay, Tony Bands, thank you so much for coming by, showing support. Y'all show him some love and support, y'all. Nightbot always doing his little job, you know. D Shep in the house, in the place to be. If I do a live tonight, I'll do an open panel because I will come back here a little earlier tonight. Okay. And thank you so much. Y'all check him out and show him some love and support. I need to check you out too. Okay, let's see. Magnificent, the finest Tyler. Y'all go check her out. Thank you so much for coming by, showing support, girl. Egan Nicole, thank you so much for coming by, showing support. Y'all check her out too and show her some love. Let's see who else. Brown Sweet. Definitely go check out the Brown Sweet as well. Thank you so much for coming by and being here too. You and D Shep, all of y'all. Let's see who else. Iceman, thank you so much for coming by, showing support. Y'all go check out Iceman. He gonna have y'all laughing. Y'all think white dudes don't be going in. They be going in, y'all. Go check him out. I told him I'm never getting into an argument with you. Cause damn, y'all be going in over there. For real, for real. Young Riz. Thank you so much, Young Riz, for coming by, showing support. Y'all check out Young Riz. That name fix him because he's a youngster, y'all. He's like 20 some years old. So go over there, show him some support, and be respectful. All right. Thank you for telling me about this, D Shep. I'm definitely gonna get this after I check with my cardiologist. Okay. Let's see who else. Mickey Gamer. Thank you so much, young man, for coming by showing support. Y'all check out Mickey Gamer and show him some love and support. All right. Let's see who else. I think that's it, y'all. And thank you to everybody who was in the bushes. I appreciate you guys too. Even the haters, hater asses. All right. Oh, D Shep. Nightbot said you got to let it go. I'm about to turn off Nightbots because y'all asses. You know what? I'm gonna reset it and make it like 20 emojis so y'all can do up to 20. All right, I'll do that tonight when I come back, or this evening when I come back. Thank you to everybody in the bushes once again. Thanks to everybody who watches us in the replay. Y'all know y'all girl Shay is crazy as hell. Y'all know this. I don't smoke, I don't drink, but my ass is crazy as hell. And thank you to Red Screen X Files. Y'all go show him some love and support. And I'm glad he popped back up because I forgot all about him. I'm sorry, hun. Y'all check him out. Y'all definitely need to check him out because he be talking about all types of stuff. Yesterday he was talking about these stars who got sexually transmitted diseases. I'm gonna put it like that. And he was talking about the solar eclipse, all types of stuff, aliens, all types of stuff. Go check him out, y'all. Get enlightened some. All right, check him out. D Shep, D Shep, D Shep, D Shep. You won't be laughing if you saw me without my clothes on, babe. That's on everything. All right. But you can tell in this dress. You can tell. See, this is me all the way. All the way. No fake nothing. No fake here. No fake here. No fake there. Well, actually, I may have. No, I don't have no Spanx. That's why you see a little pudgy little stomach right there. Nothing. I didn't have on no Spanx that day. Only in this picture, no concealer, nothing. What I did do on this picture is darken it up some, because like when you darken up your picture, you don't see shit on your face. If you have any blemishes or anything, you're not gonna see them. I didn't have any blemishes on my face, but I do. Well, when I took this picture, I didn't have shit on my face. My skin was perfect. Okay, let's keep it real. All right. But I like to darken up my picture though, because this is make your skin look more even. My skin is not even all the way through. So when you darken up your photo, it makes everything that perfect brown color. All right. Now that's what you do. Period. All right. So I keep it real all the damn time. I got the scarf on because you know I did not comb my damn hair. Let's keep it real. Y'all got a lot of hair. It's a shame that I do comb my hair. I just don't put it in styles. That's what I'm trying to say. I take care of my hair. I just don't take the time to style it and shit. But I'm gonna start doing it. You know, when my daughter did the mini tris, y'all will see that I have my hair done. That's probably when I'll get on camera too. You know what I'm saying? So there it is. Okay, and I got these juicy little lips. They juicy, but they stay cute. You know what I'm saying? I'm so damn silly. But anyway, y'all, I appreciate you too, Red Squid. We are getting ready to get out of here, y'all. Don't forget to thumbs up this video if you enjoyed this content. I know I made y'all laugh. I be trying to make y'all laugh. That's why I be saying all this crazy shit. Also, subscribe to the channel if you're not subscribed, and hit that bell notifications. Hit that bell notifications so you can be informed of my next video. Okay, subscribe, bell, and this. And if you want to show additional support to the channel, you can do that by doing a Cash App. There's nothing wrong with asking people to donate to your channels, because these channels do cost money to run. So if you want to donate to the channel, you can feel free to do so, and thank you in advance. All right. If you don't want to donate, it's cool too. Thank you so much. Y'all have a good day. I'll see you guys later on. And, have a good work day. If you don't go to work, have a good day. And just, remember, stay positive, eat healthy, take care of yourself, get some exercise, get some air, get off the damn YouTube some, and enjoy life. And I'll see you guys later on in my next live. Peace out, y'all. This is Shay's Tube. Peace out, y'all. Oh, let's go ahead and push this on. Y'all know what I usually do. Let me turn the music back up. The same routine every damn day. Let's go ahead. All right now. Let me hurry up, y'all. Y'all got me late. Shit. Let me do this right here. Let me go down here. So here we go. We're going to do that. See you tonight for Night Owls. In Brown Street, before I leave again, let me just tell you again. I remember, let me do this. I remember what I said. Okay, so I'm going to stop. I am going to stop doing that. You know what I'm talking about, because it's ridiculous. All right. And I need to grow up in that department as well. So the next live that I do, I will not do that. All right. Otherwise, you can feel free to come out here and beat my ass. And that's on everything. I told you that before. I got to stop. But you got on me today, so I know now. All right. And sorry about that, because I reneged on what I said. All right. So I won't be doing that shit no more. All right. All right.